So for the next, one of the most popular imaging modalities which we'll be looking at is what is known as what? Computed tomography. Right? Computed tomography. So computed tomography is also known as CT scan, is also known as what? CAT scan. Right? So it's a powerful medical imaging technique. So it uses X-rays. So after the X-rays, there's also some computer processing, Alright, it's a computer processing that helps to now what? Differentiate the CT scan from a normal X-ray, So to help to like produce like a detailed cross-sectioning of the imaging of the body, So it's like slicing on a loaf of bread, examining each loaf. So the details are so much, So how does it work? A rotating X-ray tube cycles the body, capturing multiple images from different angles. Alright, so can you see when you go here? Okay, the X-ray is basically here, and it's cycling till it takes a lot of pictures. So these images are processed by the computer to produce 2D slices, even 3D reconstructions. So CT scans can visualize bones, organs, blood vessels, soft tissues with high clarity. So what are the different disease conditions that we can use CT scan to dictate? So fractures, tumors, internal bleeding, stroke, brain injuries, spinal problems, heart disease, clots, lung, just name them, right? So appendicitis, kidney stones too. So these are the different types of CT scans depending on the different part of body. So you can do it for the head, the chest, in the abdomen to dictate what? Stomach issues. Angiography is anything blood, right? Angio, blood, right? High resolution, then the dual energy. Right? You can also use contrast imaging. So contrast imaging should basically what? Make images clearer, Inject the contrast imaging directly to the organ, or you give it intravenous, that's what, through a blood vessel. Risks and considerations is it uses X-ray, do you understand? So you shouldn't expose the patient too many times. So pregnant women too should also avoid CT scans. Now this is because most of the times it can affect the fetus. Then if you are giving contrast, you should make sure that the person's kidney is functioning very well. Do you understand? If not, if the kidney is not functioning very well to be able to excrete the contrast, you can have a backlog of the contrast in the body of the patient. Okay, so that's it for CT scan.